All right. Sorry about that. Just a reminder, this will be recorded and we will be posting this recording on our website, the Dementia Caregiver website. So I just wanted to make that clear, but I'm glad that everybody is here today and I'm excited to introduce our speaker, Kelly Parsons. She is a social worker here at Sanders Brown as well, and she's going to join us and talk to us about all things advanced directives. So Kelly, welcome.
Got to get my audio on. Thank you. Thank you for having me. So I'm going to share my screen and then we'll get started. Okay, so as Sarah said, I'm Kelly Parsons. I'm a social worker at Sanders Brown Center on Aging, and I've been working with older adults for about 20 years. Thanks for logging on to this webinar in regards to advanced directives or watching it afterwards. While there are a lot of things to plan for as we age, or prepare for when we might not be able to make decisions ourselves. Today, we're going to be specifically talking about how to assure yourself or your patient or client or loved one can make their own healthcare choices regardless of their ability to communicate them in the future. And before I get started, does everything look okay on the screen? I'm not able to see the Zoom side of it.
It all looks good.
Awesome. All right. So let's go over a couple of definitions first. Self-determination, you need self-determination and autonomy to make these choices, to sign these types of documents we're going to be talking about. Self-determination is the process by which a person controls their own life. And Merriam-Webster defines autonomy as the ability of an individual or group to govern themselves, make their own decisions, and act independently without external control. An advance directive is a legal document that explains how you want medical decisions about you to be made if you cannot make those decisions yourself. It's used to guide your healthcare team and loved ones when you need to make decisions for you, who need to make decisions for you when you can't. It is a legal document that provides instruction for medical care, and it only goes into effect if you cannot communicate your own wishes. Advance directives only apply to healthcare decisions and do not affect financial or money matters. The laws around advance directives are different from state to state, and in a minute, I'll show you the different types of advance directives that are available here in Kentucky. But in general, these are living wills, durable power of attorney for healthcare decisions, and a specific advance directive documents that are recognized by the state. All right. So just to kind of get in, who can make those decisions? Adults who have capacity and competency are encouraged to complete advance directives. And a few things to think about when assessing the ability of someone to make clear choices include their ability to reason, communicating a choice, and understanding that choice that they've communicated. I won't read that whole slide, but the next slide really kind of sums it up nicely, I think. So when you're assessing maybe your loved one or a patient's or client or participant's ability to make these decisions, truly, are they able to understand and retain relevant information? Are they able to appreciate the situation and the consequences that might come from it? Are they able to manipulate information rationally or have reason about it in a manner that one's able to compare and weigh options? And are they able to communicate a choice? So this is from decisional capacity and inclusionary approach. All right, so how do we start? These are conversations that can be very difficult to have, particularly if someone is fully healthy or maybe doesn't have a diagnosis, but is starting to have more healthcare concerns, but doesn't want to recognize maybe that they don't have healthcare concerns. So they have it's called the Conversation Project. The link is here and it'll be available on the slides as well that are emailed out. And so this is really to kind of start thinking about who you might want to choose as your healthcare proxy. So choosing a person to act as your healthcare agent is important. Even if you have other legal papers about your care, you can't anticipate all situations ahead of time, such as emergencies and illnesses. And in some situations, someone will need to decide about your care directives. So aim to choose a person who meets your state's requirements for a healthcare agent, is not your healthcare professional or part of your medical care team, is willing and able to discuss medical care and end of life issues or decisions with you, and can make decisions that follow your wishes and values. As we go through these conversations and some of the information that I'm going to share today, I just want to really highlight that no decision you make is a wrong decision. It is really an individual decision that is up to you, and healthcare teams and facilities follow that. And I make sure if choose someone that can speak up for you if there might be disagreements about your healthcare, maybe from your cardiologist and your pulmonologist have differing views of your healthcare or health prognosis. Have somebody that can really advocate for you in those rooms. Um, I just do want to highlight because it is required during the Medicare annual wellness visits and really any interactions with healthcare facilities that they ask if you have an advanced care directive. So there's lots of different terms. They all really kind of mean the same thing, but a healthcare proxy is the person you choose to only make healthcare decisions. Again, they do not have the authority in a financial or business capacity to make decisions. While advanced directives are legal documents, in a very small amount of situations, they are not legally binding. That's why it's so important to talk to the person you choose as your healthcare proxy. So again, the different different terms for healthcare proxy can be healthcare agent, power of attorney for healthcare, or surrogate decision maker.
You started already.
All right. So once you've maybe thought about who will be able to advocate for you in rooms that you can't speak in, these are just some of the different situations that might be asked on the is going to be asked on the advanced directive. So I'll go through those a little bit here. So when thinking about adverse health events like a DNR that cause maybe a DNR or a DNI, a DNR is a do not resuscitate order that is a medical order written by a doctor. It instructs healthcare providers not to do cardiopulmonary resuscitation, also known as CPR, if your heart stops beating. Resuscitation is CPR, the treatment you receive when your blood flow or breathing stops, and it may involve breathing tubes to open the airway. Resuscitation often requires intubation, and we'll talk about that in just a second. Another form of resuscitation is simple efforts such as mouth-to-mouth breathing and pressing on the chest. Note that the pressure and strength are often enough to break ribs when performing this measure. Another type of resuscitation is electric shock, and they also have medicine that they can inject like epinephrine. A DNI, or do not intubate order, is separate from a DNR, do not resuscitate order, although some healthcare institutions do require orders to be compatible. However, if you have trouble breathing before your heartbeat and breathing stops, and if your breathing problems continue, your heart and lungs may go into full cardiac arrest. Intubation, however, may avert cardiac or respiratory arrest. During intubation, the doctor inserts a flexible plastic tube through the nose or mouth into the trachea to help with breathing. The tube is usually connected to a machine called a ventilator that pushes oxygen into your lungs. Another type of decision that is asked on advanced directives is how you would like nutrition. Some of the medical interventions that they can do through nutrition is a feeding tube. The feeding tube delivers liquid through a flexible tube that can either go in through your nose directly into your stomach or small intestine, or you can have a tube attached to your small intestine that you directly put food into. There's also something called TPN, or total prenatal nutrition. This is a medical treatment that provides all necessary nutrients directly into the bloodstream. So it's an infusion through a catheter. And it's used when a person is unable to consume or absorb adequate nutrition through their digestive system, excuse me. So another thing to think about in regards to life-sustaining treatment is pacemakers, defibrillators, or dialysis. All right, so now that we've talked about some of the decisions that we are going to be asked in regards to advanced directives, let's talk about some of the ways we can get those decisions on paper in the state of Kentucky. These are the different types of advanced directives and how to attain them. Please note for the CDC Foundation in the top left, and for the 5 wishes and the living will, excuse me, the Kentucky one as well, you only need a notary if you cannot find 2 witnesses who are not related to you or part of your healthcare team. If you can't find 2 witnesses, then you would need 1 notary to sign and stamp the signature that they witness you signing. However, if you have 2 witnesses, again, they can't be relatives of yours and they can't be part of your healthcare team. So if somebody comes into our clinic with the 5 wishes and asks me to be a witness to sign it, I would have to decline that because it's a conflict of interest. So they've got different types of advanced directives through the CDC Foundation and 5 wishes. The 5 wishes, if you go to their direct website, it does cost $5 for a copy. However, if you get a hold of our Patient Education Center, they can send you one free of charge. You can also print out a living will on the kentucky.gov website. Again, 2 witnesses who are not related or in your medical team, or a notary is acceptable, but you do not have a notary if you do have those 2 witnesses. Another type of advanced directive is a durable power of attorney for healthcare decisions. This is typically drawn up with assistance from an attorney, but there are also websites that can assist. This would only be for healthcare decisions. And if you're getting this done, you do want to make sure that durable is in the title of the document. And the reason why is durable stands for medically aware, alert, and can make your own decisions, and unable to make decisions. So it flips both. Becomes both a legal document if you can or cannot make decisions. It's important. Okay, so you've thought about your decision, you've spoken to your physician or your medical team, you've thought about your choices, you've thought about choosing a person, you've made all of those decisions, you've got it down in paper, you've got your 2 witnesses. If you don't have your 2 witnesses, you have the notary signed and stamped it. What do you do next? Share your decisions. I cannot stress this enough. I worked inpatient in a hospital, and an older gentleman had an advanced directive, and I believe it was his niece who he had assigned to make those decisions. And when we reached out to her to make some decisions that need to be made, she had no idea, and she hadn't talked to him. And the idea of it was very, very stressful in that moment for that person. So share your decisions. Make copies of them, provide them to all medical providers, especially if you see medical providers throughout different healthcare entities like Baptist Health or UK Healthcare or Lexington Clinic. You also might want to think about putting a copy in a manila folder and put for emergency purposes and putting it right on top of your refrigerator. Um, Oftentimes, medical service personnel are trained to look at the refrigerator for any lists of medications, any healthcare advance directives, guardianship documents, things that are really important. If there's an emergency in your home and you wouldn't be able to tell someone where those documents are. You also want to provide copies to your healthcare proxy or healthcare agent, the person you have assigned to make decisions for you, and other friends and family. And this just helps if there's any concern or question about who's able to make those decisions. Everybody's got the same form and everybody can review it if they need to. You also want to think about um, donation cards or documents of consent. So if you donate your brain to Sanders Brown, you want to make sure you share those donation cards with those numbers of who to call after you pass away. Or organ donation, that's a really important topic to discuss as well. If you're able to donate your organs at the end of life, sharing that with your loved ones. And then just kind of this asterisk here, think about filling out release of information or permission to communicate medical um, diagnoses to facilities for the healthcare proxy. So this is a completely separate form. It's a release of information within a healthcare facility. All healthcare facilities have them. And if for instance, my mom has me on the release of information for her health providers. So if she's unable to share something, then I can reach out to them and very quickly get that piece of medical information or diagnoses that I might need. So just a thought, even though it's not an advanced directive, something to keep that conversation and those decisions well laid. All right. So just to kind of review steps to complete an advanced directive, you want to think about your wishes and your values. Remember, these are yours and your decisions are correct decisions for yourself. It doesn't matter what the neighbor did, your daughter did, your brother did, your wife or spouse did. These are your decisions to make yourself. Talking to your doctor, especially if you have a chronic or progressive medical diagnosis, talking to your doctor about what might be coming. I know with Alzheimer's disease, people lose capacity and competency. So talking about what might the future look like in regards to your health situations will also help you make those decisions. And then choosing someone you trust that will advocate for you and follow your wishes, completing the forms via the different resources provided, or any medical facility that you walk in. If you ask for an advanced directive form, they should be able to provide one to you as well. So just keep that in the back of your mind. Again, share those forms once you've made those decisions and gotten those signatures far and wide, and keep the conversation going. Every so often, if you think about it, or if there's a new diagnosis or a new medication, or maybe a new medical procedure like cochlear implants or something like that, talk about that with your trusted care team and decision maker that you've appointed as your healthcare proxy. This is important stuff. All right. So just to kind of recap, we've gone through the why we might need an advanced directive. We've gone through the how and really the when. When should I do it? Well, no time like the present. Now, our list of things to do is very long. I understand that. But really, after you have gathered enough information and thought about the decisions you want to make that you're comfortable with, is when you want to start putting that pen to paper, those thoughts down on paper. After you've talked to those around you, um, and ensured the proper procedures for documents. So signatures and things like that. Right, and a little bit early. Okay. So this is just conversations about what you might want to tell somebody. And I won't get into all of them, but I would be remiss if I didn't mention these. The highlighted blue ones are the ones that kind of fall within advanced directives. But thinking about where the deed to the house, the will location. I know my mother-in-law spent 7 days looking for their will when her husband passed, my father-in-law, years ago. It was very stressful. Durable power of attorney. This would be more for business matters, and that can be another topic of conversation or presentations later on. But these are different types of documents and conversations you want to be thinking about when you think about sharing your wishes at the end of life or if a medical emergency might happen. So these are just some things that are included within the slideshow. The CDC has a complete care plan, and there's a link at the bottom of the next couple of pages where you can find this. But when you're filling out an advanced directive, it might be beneficial for your healthcare proxy to have this as well. This is all of your diagnoses all in one kind of document, because Lexington Clinic might not have electronic medical records that talks to UK, or the VA might not have the electronic medical records that talk to Baptist Health. So your medical facilities might not be able to talk to each other, but if something like a complete care plan is filled out, your healthcare proxy will know exactly where to find things, who's part of your healthcare team, and what conditions or diagnoses they're treating. This is a really succinct information, and it doesn't mean you have to fill out all of these things. If you just want to print it and fill out your medications and your medical providers, a, a little bit of information is better than no information. So just keep that in mind as well, because I know it can be pretty overwhelming. But again, it's just caregiver resources. If you need help with driving or cleaning, things like that, you'll have those people listed here within this complete care plan. And then the medication list, and I did want to just highlight, this is the website that you can find this. It's a PDF on the website. It's easily printed out. And then another thing I wanted to highlight was just kind of the putting things in order. And this is kind of pursuant to that one of those last slides that I showed. Again, this can be very, very overwhelming. Some of it won't adhere to you specifically, but just things to have to talk about. I know I still don't know all of my husband's passwords, and I should. God forbid if something were to happen. Excuse me, sorry, I just had a quick lunch before I started this. I apologize. But this is just things to think about, where to find things if somebody needs to find things for you. All right. So that might have gone a little bit faster than I anticipated. Thanks so much. I'm going to stop sharing now and see if anybody has any questions.
Kelly, thank you so much for sharing all of this really important information. I appreciated the way you kind of went through and explained all the terms, because sometimes those terms can be so overwhelming. So thank you very much.
Thank you. Thanks for having me.
One last call if there's any questions. A reminder, we will be sending out a link to the recording as well as the PowerPoint slides. And I think a couple of those handouts we have too about the things to look through, we'll send out as well. There's just a handy reference sheet.
Hey, this is Amber. I just wanted to tell you guys thank you. At first, I was having a problem with my audio, but I eventually fixed it. So, yeah.
Awesome. Thanks for being here. We appreciate it.
Mm.
All right, well, if there's no other questions, we will end for today. Be looking for an email in the future. We'll have another video series sometime in May. So I'll send out details for that when it comes along. So thank you for joining us, and have a great rest of the day.